Hi, I'm Ashley, and welcome to my presentation on Crossroads Children's Mental Health Center. So a little bit about them is they offer services for children up to the age of 12. They use informed evidence-based practices, meaning they use up-to-date research to better assist their children in their care when treating them. And they don't do diagnoses or referrals. You have to go to places like CHIO to get those things. And you actually don't need a diagnosis to even come. They just want to treat behavior and not label the child. And you don't even, yeah, you don't need a diagnosis to come. You just need to reach out to them with your concerns, and they'll be willing and happy to help. Um, so their offered services are their in-school services, in-home services, clinical and therapy treatments, their TAP-C, which is their arson prevention program, their intersection program for children at risk of possibly joining the justice system, or becoming involved, I should say, yes, with the justice system. Parent groups and the wraparound programs, which goes in with their in-home services. So as for the parent groups, we have the collaborative problem solving group, which is 8 weeks, and it's done with other parents. So this is like a real group thing, and your child is not there. It's just for the parents, and it's designed to help parents with conflict resolution to like de-escalate situations before they escalate, and like preventing conflicts in the home and how to better deal with like these conflicts that may arise and challenging behaviors. And you're connecting with other parents in a safe, non-judgmental way or space. And the Circle of Security group is also 8 weeks, and this one's only for parents with children ages 6 and under. So this one's designed for attachment. That's why it's done for the younger children, because attachment is done at more like the younger ages. And it's to respond better to their child and respond and learn the child's cues so they can actually develop and have that secure bond with their child. So yeah, that's the parent groups. And their TAP-C, which is the arson prevention and the intersection program. I put these on the same slide because they kind of go hand in hand. So the TAP-C is the arson prevention program. And this is designed as an intervention program for children who they suspect may be at risk at setting inappropriate fires or arson. And they teach fire safety and just like work with the child to figure out what's going on and how to overcome this possibility and risk of them creating fires in the future. And as for their intersection program, this is partnered with Ottawa Police Services, and they work with youth that they may suspect could possibly have mental health issues or um, substance, like be at risk of having substance abuse or becoming involved with the justice system. So basically, they're at risk of becoming incarcerated in the future and like possibly getting into a lot of trouble, and they take preventative measures to ensure or hopefully ensure that this does not happen in the future. Um, Therapeutic jujitsu is another service they offer. It is a little bit pricey at $600, but this can be covered under the Ontario Autism Program, or some insurance plans can actually cover it as it's related to the psychotherapy or social work, so it can be categorized under that. And the facilities are on site, so it'll be for a familiar place for you and your child, which I really like. And there's a 1 to 2 ratio, meaning there's one adult for every 2 children. And they also said that no matter what, there'll really be 4 adults on the mat at all time. And these adults are trained to deal with behaviors and assist the child whenever they need it. And yeah, so if they need to be taken off the mats or anything to just calm down, they can do so and rejoin when ready. And jujitsu is not about injuring the opponent. That's how this is a little bit more therapeutic. It's about actually causing your opponent to eventually give up or surrender, or leading them to submission, as they call it. Yes. And jujitsu actually teaches emotional regulation. And as a person who has taken jujitsu, I would agree it really teaches you in the moment thinking skills and yeah, emotional regulation and just how to like remain calm in like intense situations when you're literally like being put into submission and you have to think things through to be able to actually battle your opponent. Like it can be a very like slow sport at times. But yeah, but the way they do it is that within the first week they actually teach like they ask the children like what and teach them like what their emotion the they focus on emotions and the cues in the body and what their body is telling them when they are feeling these emotions, and then they work off of that in the later weeks. So then they'll learn the cues and then they'll learn how to respond to the cues while teaching them a skill, which is jujitsu. Um, and one thing to add is I really like that they teach them a skill as well, because I feel personally, this is just personal notes, that the teaching them a skill can give them confidence, as maybe we know if we took the ECE program, because it gives them something that they can feel good about, and it gives them like actual skill and purpose. Anyways, moving on to some of the practice they use. This is something they may use in their clinical, in-home, or in-school treatment, or even in their parent groups, as the circle of security is a method they use. So, collaborative problem solving. This is a trauma-informed approach providing the child and caregiver with thinking skills they need to create a lasting change over using the traditional methods such as the reward and punishment system or classical conditioning. And going on, we have the circle of security, which focuses on building a secure bond, which is the method they use in their parent group with the circle of security. And then they have cognitive behavioral therapy, or CBT, which is very commonly used. And this one's a short-term therapy that provides the patients with the skills to overcome their day-to-day issues. Emotional focused family therapy. They better develop their emotional regulation skills and ways to avoid these negative emotional regulations. And this is used primarily when treating eating disorders. Practice is continued. The feedback informed treatment used primarily in their in-home services to gain feedback from the family to ensure methods are effective and working. And the interesting part about this one is that they're trained not to be offended. Like they're literally trained not to be offended. So if you tell them, no, this is not method is not working, then they will go, okay, and they will change their methods and make sure it's better suited to you and the family. Yeah, you and the child and the family. Because they want methods to work so then the child can get better. But, anyways, trauma focused cognitive behavioral therapy focuses on trauma, so it's actually very similar to CBT therapy, cognitive behavioral therapy, but it has a focus on trauma and overcoming that trauma instead of day to day issues. And as for the zones of regulation, offered in parent groups to provide caregivers with the skills they need to support their child's emotions, needs, and able to harness a proper emotional regulation by controlling their impulses, becoming aware of their emotions, managing their sensory needs. Manage sensory and their sensory needs and improve readiness to problem solve. There we go. And finally, for my conclusion, so they offer a variety of really unique ones, which is like the jujitsu, which I think is unique. After doing a Google search and some other research on some similar mental health services, the Lanark one does not have jujitsu. YSB does not have jujitsu. So this is very unique to just Crossroads. Nowhere else seems to offer this form of therapeutic jujitsu, especially for children in a clinical setting. And they focus on treating the child over labeling. This is something that I found out from the interview, and I felt like it was a really like good quote from her because it just made me feel like they care more about helping the child over like the diagnosis and just like giving them a diagnosis and sending them off. Like the person I spoke to just seemed like they really care, and from their website, it just showed that they really overall cared. But yeah, they use informed evidence practices and their up-to-date research, and they just show that they really, really care based off what I have learned. They really care about the child. And yeah, here's my references if you would like to look into it. Anyways, that's 10 minutes, so have a great day, everyone. Thank you for my presentation.